Grand-Yapo, 80 kilometers east of Abidjan. In this tiny health center, there are no doctors, only a nurse. And the equipment is extremely basic, to say the least. This is where the 10,000 or so inhabitants in the region come for medical care. One of them today is Nadège. Her son has been very weak for a few days. Are you able to eat properly? Are you eating well? Have you had any headaches? Have you been coughing? He suffers from malaria. Malaria. Out of the 200 monthly appointments at this health center, 150 to 180 are related to malaria, the leading cause of death among children under 5. However, over the past few months, even though there are still as many patients, they come back less often. This is all thanks to the new treatment, ASAQ, which treats malaria attacks with fewer tablets. Before, patients had to take the drugs over 5 or 6 days, but would often stop taking them after 3 days, if they did not see any improvement. This encouraged resistance. Now it's just 3 days as a single dose, which is easy for everyone to remember. However, the success of this 2-colored tablet is also due to its very competitive price, less than $1 for adults and half that for children. The group of researchers who developed the drug believed that this was a key to its success. Here, the household health budget is rarely more than $80 per year. The pricing issue for ASAQ was an inherent part of the project from the very first year. This project could only have a future, a purpose, and the desired resonance if the price of ASAQ was as low as possible. From the very onset, the project consisted of making ASAQ a public resource, since the research phase was largely supported by public funds. Sanofi Aventis played the game. While the drug had already been available in the private sector since April 2007, under the name Corsicam, ASAQ was specially created for the public market. Only 20% of the population had access to Corsicam on the private market, while the remaining mostly impoverished 80% could not have access to treatment and were exposed to the scourge of malaria. It was our responsibility to provide these 80% with efficient treatment for less than $1, that is, at cost price. This is known as tier pricing policy. The company is going further than simply delivering the drug, since it is also involved in training healthcare personnel and providing information resources. Like the flip chart here. To raise awareness of malaria among the populations, all hand in hand with the local authorities. This type of comprehensive solution is suited for public institutions with insufficient funding. We are convinced that no major changes will be seen at the state level. We cannot see how the state budget could double or triple within the next 3 or 4 years, while the population continues to increase, along with the number of cases of malaria. Hence, the needs will always be huge. We believe that this type of partnership will enable us to deal with health issues more effectively. 6 months ago, 420,000 treatment units were delivered here to the public health pharmacy, to be redistributed to health centers throughout the country. Today, there are only 175,000 left. The formulations for infants and young children have been out of stock before, which best reflects that this type of product has been awaited by the population. The aim is to extend this experience to other countries in the very near future.